Elizabeth Cohen. Back with us now is Dr. Lena Wen. You just wrote a new op-ed in the Washington Post where you argue it's time for President Biden to consider vaccine mandates. Tell us why.
There is this narrative that the Biden administration and many others have been putting out, which is once you're vaccinated, you're fine. And so the natural conclusion from that is, why would you care if others around you are vaccinated or not? If you're protected, then why not let everybody else just do whatever they want? The fact, though, is that the unvaccinated also affect the vaccinated. If you are a vaccinated person, but you're living among a lot of unvaccinated individuals, as Elizabeth was just showing in these clusters, your chance of having a breakthrough infection increases. Your chance of infecting others around you who are unvaccinated also increases. And by the way, the more unvaccinated people there are, the longer this pandemic is going to be. We have this Delta variant that's so contagious that that actually increases the threshold of how many people have to be vaccinated in order to reach herd immunity. We could have other variants that make it even harder for us to end this pandemic. And so my point is that this is not just about the individual. This is about our society. And I hope that the Biden administration gets on board with that kind of a societal approach to health and well-being.
It's just so exasperating. It works. It makes a difference. There are so many reasons to do it. I wonder, on the good news side, the vaccines, the existing vaccines, still have very good protection against infection from the Delta variant and extremely good protection in terms of keeping people alive and out of the hospital, right, with the Delta variant. I wonder, is enough of the country vaccinated to keep this largely a regional outbreak problem as opposed to a national outbreak problem?
I think so, and I certainly hope so. I doubt that we're going to see the kind of national surge as we did last winter, where hospitals were overwhelmed in all these different parts of the country. But that said, I do think that we're going to have these regional outbreaks, because we're already seeing that in some parts of the country, we're already having staff once again being overwhelmed and overtired, caring for patients, and potentially patients with other medical problems having difficulty seeking medical care as a result. And so I think we really need to acknowledge the existential threat that we're still facing of Covid-19 and how disappointing it is right now, because we actually do have a vaccine, exactly as you said, that's so effective at essentially reducing your chance of dying to zero.
So here's a question then. For you and me, we're vaccinated. Maybe a situation, not everybody in my family is vaccinated, for instance, because some of them are too young. What do we do now? And should folks who are vaccinated rethink their own kind of reopening, right, in terms of how much they travel, where they travel, and when and how often they wear masks?
I think that will depend on a couple of factors. One factor is your own medical situation, and that includes the medical situation of those in your family. If you're healthy, everybody else in your family is healthy, and you're vaccinated, then I think the risk to you is still going to be very low, and I don't think you should have restrictions on your own activities. On the other hand, if you live at home with someone who is immunocompromised or with young children who are not vaccinated, I still think that you should take some additional caution. And in that case, look around you and see what is the situation around you. Do you live in a community with high vaccination rates and low infection? If so, you're okay, but otherwise, take additional precautions.
Yeah. Goodness, it's sad that's a necessity. Dr. Lena Wen, thanks so much.